So I'd like to officially welcome you to Star Sunday. We've got a really exciting morning planned for you. I'll be comparing the morning and making sure that we all keep to time. And my first job is to introduce this morning's keynote speaker, Dustin Turner. So Dustin lives with CMT1A. Dustin's symptoms appeared in childhood, but he wasn't diagnosed until 2021. Since his diagnosis, Dustin has become a passionate advocate for the CMT community, and he's a committed CMTA volunteer. He helps to raise funds and awareness through events like Cycle for CMT. Dustin works in finance leadership at a clinical stage biotechnology company, and he brings a deep understanding of the challenges involved in developing new treatments. Dustin believes strongly in the power of rare disease communities to drive research forward and to serve as active partners in our search for cures. It's my absolute pleasure to welcome Dustin to the stage as the 2025 Star Sunday keynote speaker. Dustin.
Thank you, Dr. Forsey, for that introduction, and thank you to the CMTA for allowing me to have this opportunity to share my story. I'm so excited to be here with you all to learn about the continued progress being made by CMT researchers, to hear about how the CMTA has been working on our behalf over the past year, and to connect with this amazing community of people who are driving all this progress forward through the CMTA. I'm looking forward to sharing my journey today about getting diagnosed, what life has been like since my diagnosis, and how the CMTA has fit into that journey. My story starts back in 1992. I was in kindergarten, and my teacher in kindergarten had required every student to do a pull-up when they came back into class. And she'd been teaching for a number of years, and I was the first student she had who was unable to do a pull-up out of all the little boys and girls that she'd been teaching over a number of years. And so she reached out to my parents, very concerned that I wasn't able to do this, and that led to my first interactions with the healthcare system. We ended up going to a pediatric neurologist, and while I didn't know why we were there, I do remember that his office was really cool, and he had fun toys that I could play with while he talked with my parents. And the portion of the exam that I remember is him having this rubber mallet that he would hit my knee with, and I was pretty curious, why are we doing this? And he told me, I'm testing your reflexes, and when I hit your knee, it should move. And that wasn't happening, and my thought was, he's just not a great doctor that he's not able to get my knee to move. And so that went on for about a year where we would go and visit him. And I recently asked my parents, what happened with that? How did I not get a diagnosis out of that? And the answer was, he saw you over the course of the year, and there wasn't really any change in the presentation of your symptoms. And so his thought was, it was a one-time neurological event, and that was all that I needed to see him for. It seemed like I would just continue on the way that I was. And so life went on, and I continued to think I was, just a normal kid. And when the first time that my symptoms became visible to me was about second grade. I had been playing t-ball and soccer for a number of years, and all of a sudden I would hit the ball with the bat, and I would barely be off home plate before the ball got to first base and I was out. And the same thing in soccer. We would all be at one end of the field, play would shift, all the other kids would run down, and I would still be near the goalie, wondering how these elite athletes on my town team had made it so far. And so I just kind of naturally fell out of athletics and leaned into the academics. Over time, I was still, a little bit clumsy and just wasn't really developing muscle the way my peers were. And I remember going to a regular checkup around middle school, and my primary care doctor diagnosed me with what he called failure to thrive. And for me, as a 12 or 13-year-old boy, that felt like what I was hearing from everyone else, except it was medical now, that I just wasn't trying hard enough to succeed in life, and that if I worked a little bit harder, I would thrive. Life continued. There were multiple doctors along the way where we tried to figure out what was going on with no results, and I went off to college. And then after college, I ended up working in public accounting, which required me to dress up for work every day and wear stiff leather shoes for really the first time in my life every day. And that was painful, but I'd seen these Dr. Scholl's commercials and just thought everyone finds dress shoes uncomfortable. I just need to get some inserts. And so I made an appointment with a podiatrist to try to get custom orthotics. And that was a 4-appointment process from intake to receiving my orthotics. It was a significant amount of time off work, and it was hundreds of dollars on these custom orthotics. I really felt taken advantage of by the way he spaced out my appointments. But the orthotics did help with the pain that I was feeling in wearing my shoes. However, they caused my ankles to roll constantly. And so I went back to him and I explained, these are helpful with the pain that I'm feeling, but I fall more often than I did pre-orthotics. And he gave me some ankle strengthening exercises and sent me on my way. And I felt really discouraged, thinking, I never work out the way I've worked out with a lot of friends. I never get stronger. These exercises, I'm just not going to be able to do them the way that I'm supposed to do them to get stronger. So I just moved on. And I started a new job in my late 20s, and my team went for walks every day. And on these walks at lunch, I would often fall flat on my face in front of this group of 10 people. And I would just pop up, and we'd continue on the walk, and my teammates were so gracious about it. But one day, our department head pulled me aside, and he said, hey, I noticed you fall a lot, and I've noticed your shoes are kind of worn out. I think maybe you just need to replace your shoes more often. And for me, I thought, is too cheap to buy new shoes the reason that I've been having all these problems? Do I just not take care of myself the way that I should? Things just kept getting worse, and I kept falling more often. But I thought, I live in Boston, which is this healthcare mecca. And so I made an appointment to see a top podiatrist at a teaching hospital in Boston. And the doctor did an examination, and I explained, my history. And he asked me, since it was a teaching hospital, if he could go out and bring residents in to help teach them. And I said, sure, yeah, I know it's a teaching hospital. And he went out, and I'll never forget hearing him outside the door say, I've never seen a pathology like this before. I want you all to come in and look at this with me. And for me, that was so incredibly discouraging, knowing this man's going to come back in, but I'm not going to get an answer here today. If he's not seen anything like this, today is not the day. So he brought the residents in, and he looked at me, he manipulated my foot, and he talked to these residents like I wasn't even in the room. And it was just so incredibly dehumanizing for me. And then at the end of all that, he turned to me and said, what I can offer you is custom orthotics for $900. And I said, we just talked about how orthotics didn't work for me and made me fall more often. And he said, that's the care plan I'm recommending for you. If you're not willing to follow that, I don't really have anything I can do for you as a doctor. And so I left incredibly discouraged, thinking, I'd gone to one of the best hospitals in one of the best cities for healthcare in America. This is as good as it's going to get. There's not going to be any answers for me. And then thank you. A few years later, I started talking to someone new that I met on Hinge. And that person is here with me today, my partner, Jared. And about a month after meeting Jared, he mentioned that the way that I walk and the shape of my foot reminded me of a friend of his who had a disease that I'd never heard of before. Now, I've received a lot of unsolicited advice on my health over the years, and I was very skeptical about Jared attempting to diagnose me a month after we met. However, it was early days, and I was still very interested in impressing him, and I agreed to at least look into this disease with the name I've never heard of before. And so we Googled Charcot-Marie-Tooth disease, and I was very surprised to find that I met so many of the symptoms. And so we found the CMT Center for Excellence in Boston, led by Dr. Reza. And that appointment in 2021 was different from all of my prior attempts to get help from the healthcare system. Dr. Reza did a thorough evaluation for my CMT, including an electrodiagnosis or an EMG to identify the type of CMT that I might have. And he recommended genetic testing to confirm that diagnosis. Also, while I was there, similar to the great system that the Indianapolis doctors talked about, I got to see another professional, Dr. Kathy Chong, who's the head of neuromuscular rehab at Boston. And she was so great about explaining the options that might help me manage my day-to-day with CMT. And then the day got even better. Ken Cornell, who spoke yesterday, happened to be there, and he was able to show me how I might benefit from AFOs, all in this one appointment. And so I had gone from all these visits where I had never received any help, and that podiatrist appointment where he stretched out over 4 visits to get me orthotics, to this one appointment in one afternoon where I found out what was wrong with me, I was given solutions, and then I was set up to find out how to get braces. And it was just so amazing to leave with that hope of, for the first time, knowing it wasn't my fault, the things that were going on in my body, and to have possible solutions. As a result of that genetic testing, I was able to be one of the last patients to enroll in a phase 3 trial run by Pharnex that was looking to slow or stop progression of CMT. And I just felt like things were going so well for me. And because I had seen the CMTA for learning about this idea of centers of excellence, I was so excited to learn more about this organization. And so I reached out to Jill Ricci, who's the Boston branch leader. And I'll say, joining new places as an adult can be scary. And she was just so incredibly welcoming and bringing me into the CMT community. And so I attended Boston branch Zoom meetings. And I'll say that the summer issue of the CMTA newsletter, where we talked about community is everything, really resonated with me because it was so exciting to be on those Zoom calls and hear other people who were living with CMT and what they were going through. However, I was looking for more in-person community. And in my research, I happened to find that close to us in Vermont, there was going to be this Cycle for CMT event. And I was so excited to go and join that and meet other people living with what I was living with for the first time in my life. And I'll say that part of that ride was raising money, and that was really scary to ask people for money for the first time. But I'll say not everyone can give or is willing to give, but people like helping other people, especially ones they care about. And it really built strong connections with people that I knew to share with them and for them to be able to help me. And it was so amazing to go to that event and to meet other CMTers in person and see how they were living and to see people living a full life even with this disease. And also to hear about how people were advocating for themselves in this community. The following year, I was so excited to go back to Vermont, and I reached out in early 2023 to find out when the event was going to be open and when we could register for it. And the CMTA said, we're not hosting an event in Vermont this year. And I was so bummed that all of this community that I just found wasn't going to be available that next year. But then shortly thereafter, the CMTA reached out and said, we're going to do local events this year. Would you be interested in organizing a ride in Boston? That was overwhelming. I've never done anything of that magnitude before. The idea of organizing an event, finding a place to do a safe ride in Greater Boston, and bring people together for that was really scary. But we got paired up with another couple from Boston, Mary Kate, who has CMT4C and is probably going to be the reason 4C gets cured. She's just incredibly passionate about her subtype, and her husband, Aaron. And it was just so great to work with them pulling this event together and to be supported from the CMTA nationally and by Jill locally as we put that event together. It was a really great event. We had 30 people turn out, and we were able to raise over $38,000 for the CMTA. And all of a sudden, what was this really scary idea became really manageable. From the time I got diagnosed, things just felt like they were going better and better. But shortly after that cycle, I had an appointment for the trial that I was on with Dr. Reza, and he let me know that Pharnex was canceling further development because the trial data was not successful. And that was the first time in my life that I really had to grapple with my diagnosis. All of a sudden, my disease wasn't being slowed or stopped by the drug I was on. And there was nothing else in the clinical pipeline for patients with CMT1A. And that was a very hard reality for me. But I'm so grateful for the CMTA and the community that it's built because I had all these role models of people who were living successfully with their CMT and living full lives. So as we entered 2024 for the cycle, it had real increased meaning for me to continue to advance this agenda to fund research and find cures for CMT. We ended up combining with the walk that year and being able to even more leverage Jill's experience running Boston Walks for 10 years. We had 71 people participate last year, and we were able to raise over $53,000. And it just felt easier the second time. And so I'll say, if you're scared of doing something new, it gets easier over time. And so I'm so excited. We have our third event later this month, and I'm so excited to build more community with more participants, to raise more awareness, and to raise more funding for the CMTA. And I'd like to end by calling everyone here to action. You've already taken the first step by coming to this meeting to advocate for yourself or for your loved ones. I've heard several of your stories this weekend, and they were powerful. And I'd just like to say, another thing that I didn't talk about in doing this event is I knew that I would have to share my story with more people if I was going to be willing to run this local event. And I'm very fortunate. I have symptoms, but I, quote-unquote, pass. It's not necessarily obvious to everyone that I have a physical disability. And so voluntarily outing myself as someone who's disabled was a really hard choice to make. But I really, really want a cure, and so I was willing to do that. And so I'll say, if you're keeping your CMT in the closet, come out loud and proud. There's no shame in being disabled. You can help other people by living openly, and you're really going to build these authentic connections with people you know who are able to show up for you and show how much they care about you with what you're dealing with. Share your CMT stories widely. Build awareness and pave the way for people to get diagnosed early and to have those interventions earlier. And then volunteer opportunities abound. I know Gina did that session yesterday showing all the ways that we can participate. Ask your local branch leader how you can support them. Think about Camp Footprint. Talk to the CMC staff about what you can do. Also, patient voices shape research. Look at how you can be involved in trials. Getting my genetic confirmation of what subtype I had opened the possibility for me to be able to participate in a trial for 1A. Consider that with your doctor on whether that's right for you so that you might be able to advance research. And then raise money for the CMTA. Dr. Forsey talked about how I work in finance in a biotech company, and I can tell you, based on my experience, drug development is expensive and it's risky. 90% of drugs that enter the clinic fail. And so these companies, which are all for-profit, need help from patient groups that are organized to de-risk assets so that they're willing to take some level of risk to move things along into the clinic. And STAR is so important to move potential treatments into the clinic. I'm really excited to hear later today about all the work that's been done in STAR over the past year, but that takes money, and no one is going to give unless we ask them to give and believe that we're worth it for them to give. And so I'm going to ask a question, and I'm hopeful that you'll publicly respond by raising your hands if you'll agree to this. But will you commit with me today over the next year to find one way to advocate for yourself and your loved ones in this community, either by sharing your story with others, finding volunteer opportunities with the CMTA, joining a clinical trial, or raising money to support the CMTA and STAR? If you're willing to commit to that today, will you raise your hand with me? Thank you. I'm so excited for what we might accomplish in the next year and for the progress we're going to make together. Thank you so much for allowing me to share my story.
Thank you. That was wonderful. Here.